Hi, this is Dr. Matt Lawless with another knee moment from Knee Fit in 5 and MSM products. Jason from Texas writes in and asks, what are the different types of knee arthritis? And that's a very common question I get. By far the most common form of knee arthritis is osteoarthritis, and that's probably responsible for at least 95% of the different forms of arthritis of your knee. It is considered a non-inflammatory arthritis. What osteoarthritis of the knee is where the cartilage of the bones at the tips in your knee start wearing out. So in this knee model here, let's assume this is blue part is cartilage. When it starts wearing out, like you see it here, then that's called osteoarthritis. What happens is the cartilage slowly starts breaking down with time, and as it gets more advanced, this area keeps getting bigger and bigger. You can see here that this is what we would call bone-to-bone arthritis, where the cartilage is all gone and you have exposed bone. So on a standing x-ray, you would see this bone touching this bone, and there would be no black space in there where the cartilage normally is. So like I said, that's osteoarthritis, and that's responsible for at least 95% of knee arthritis. The other 4 to 5% of knee arthritis is what's called inflammatory arthritis. So like I said, osteoarthritis, probably more of a genetic component and responsible for most of it. The 4 or 5% is a inflammatory arthritis as opposed to the non-inflammatory osteoarthritis. Inflammatory arthritis has to do with the synovium or lining of your knee joint. So your knee joint is surrounded by a little capsule, and your knee joint is one big capsule like this. The lining of your knee, so this surrounding tissue, the lining of it is called the synovium. When that gets inflamed, then the synovium can get inflamed, and then that can inflame the cartilage and start eating away the cartilage. So instead of the cartilage falling apart on its own, like in the non-inflammatory osteoarthritis and the inflammatory types of arthritis, then it comes from the synovium or the lining of the knee and gets into the cartilage that way and starts eating away the cartilage that way. So the end result for both of them is the same, where the cartilage goes away. It's just a different mechanism of how it happens. There are many types of different inflammatory arthritis. Probably by far the most common is rheumatoid arthritis, but you can also have gouty arthritis. You can have Crohn's disease or other inflammatory problems causing arthritis as well. So, Jason, thanks for your email, and I hope that helped.